But, Mr. President, I am joining my freshman colleagues on the floor today to talk about how health care reform will improve women's access to care. I received a heartbreaking email just this week from a young woman from North Carolina. When this woman was 27 years old, she was diagnosed with breast cancer. She had a 16-month-old son and was in an abusive relationship with her husband. Her husband knew that she would not leave him because she couldn't afford medical treatment without his employer-provided insurance. She looked into COBRA, she looked into other individual insurance plans, but her breast cancer was obviously considered a pre-existing condition. So for 7 years, this woman stayed in an abusive relationship because she had to have health insurance for herself and her child. And unfortunately, women across America face similar challenges to exactly what this woman has faced. Inefficiencies and discriminatory practices in our healthcare system disproportionately affect women. In a majority of states, insurance companies are permitted to charge women more than men for the exact same insurance policy. In Washington, D.C., and in 8 other states, insurance companies can deny coverage to victims of domestic violence, citing that as a pre-existing condition. In all but 12 states, insurance companies are allowed to charge women more than they charge men for coverage. In my family, my daughter, who just graduated from college, out there looking for health insurance on her own, was quoted many times more money for her coverage than if she had been a male. Only 12% of individual market policies provide comprehensive maternity care. When women do have health insurance, it often doesn't cover basic preventative care like mammograms and pap smears. In the Health Committee and in the Finance Committee bill, insurance companies can no longer charge women more than men or use pre-existing conditions to prevent anyone from purchasing health insurance. And we are ensuring that basic preventive screenings will be covered. I am focused on sending our president a bill that ends discriminatory practices against women, provides security and stability for people with insurance, expands access to health insurance for those without it, and slows down the skyrocketing cost of health care. Women across America cannot afford inaction any longer. Thank you, Mr. President.